Good afternoon. So my name is Dr. Rajnandhini Sinha, and today I'm going to discuss about the topic coagulation. So before starting this topic, I'll discuss about some few terms that is known as platelet adhesion, platelet activation, platelet aggregation, primary hemostasis plug, secondary hemostasis plug, coagulation, thrombus and embolus. So before starting these few terms, I'll give you a brief definition about coagulation. So coagulation is nothing but the conversion of insoluble fibrinogen into insoluble fibrin strand. So this fibrinogen is produced in the liver and it is present in the every single drop of blood, and it is one of the clotting factor. And what and this is like this fibrinogen, it is converted into insoluble fibrin strand, and this is known as coagulation. And before starting the coagulation process, I'll show you what happened in the normal healthy blood vessels. So for example, this is a vascular system and this is blood like RBC. So in case if there is any injury, so what happened, it is not externally clotted. All this clotting substance are from the constituent of blood. So this is not from the external side, this is everything is from the internal side. So this is how a normal circulatory system work. And before starting coagulation, I'll show you how this process work in injured system and healthy vascular system. So for example, this is a healthy vascular system. This is endothelium, this is collagen, this is endothelium, and this is a vascular system. So endothelium release prostacyclin, nitric oxide and ADP dephosphatase. So what ADP dephosphatase means? It means it is a ADP enzyme cutter. So here is the platelet, and what ADP does, this is ADP dephosphatase. What ADP does, it will favor the platelet to stick to the collagen or basement surface. So it will always stick to the collagen surface, not the endothelium. So this is how ADP favors the platelet to stick to the collagen surface. So what happened here, this ADP will cut down this process. So this process doesn't happen. So that is why this 3 is called as, these are the vasodilators. So now I'll show you the natural anticoagulants in our body. This is heparon sulfate. And in heparon sulfate, this antithrombin get stick to it. And this antithrombin, what it does, it will eat up factor 10A, 9A and thrombin. As we know, these 3 are coagulant factors and this will help the blood to clot. So these are getting eaten up by the antithrombin, so there is no coagulation process over here. So this is how the heparon sulfate work, and it is a natural anticoagulant factor. Now I'll show you, there is one more thing which is called as thrombin modulator. What it does, it will stick to the thrombin, and thrombin will release protein C, and this protein C will eat up factor 5, factor 8, and because of this is getting diminished over here, so there is no clot process happening. And there is one more thing releasing from endothelium, that is tissue plasminogen. Tissue plasminogen, what it does, it will convert plasminogen into plasmin. So endothelium will always release one more thing, that is tissue plasminogen. Tissue plasminogen will release plasminogen, which will convert into plasmin. So this is how it works. So vasodilators are ADP dephosphatase, nitric oxide and prostacyclins, and the natural anticoagulants are heparon sulfate, antithrombin and thrombin modulator and tissue plasminogen. So this is what happen in healthy vascular system. I'll show you how injured vascular system works. I'll show you how injured vascular system works. From the injured vascular system, there is a release of endothelium. As there is no endothelium over here, this will release a vasoconstrictor called as endothelin. And as we know that where there is an injury, there is a nerve damage and smooth muscle damage also. So in case of nerve damage, there will be a process known as reflex neurogenic vasoconstrictions, and it will release some vasoconstrictors. And in case of smooth muscle, there will be reflex myogenic vasoconstriction. So in both the case, in nerve damage and smooth muscle damage, there will be vasoconstrictors releasing, and these three are the vasoconstrictors. So here one more thing, I'll show you how it works. So in this case, as the endothelium is damaged here, the endothelium will release some sticky kind of chemical, which we call as von Willebrand factor. This is von Willebrand factor, and it is also one of the coagulation factor. So von Willebrand factor have a hook like thing. This is a hook like thing. Where it works, what happened here, this platelet also have a receptor. So we have heard many times that the people having platelet deficiency, like for example thrombocytopenia, so in that case many people they think like there is no platelet in the body, but that is wrong. Actually there is no receptor present. If the receptor is not present, this von Willebrand factor won't get attached to it. So in that case there is the disease called thrombocytopenia or platelet deficiency. So this is how the platelet will get attached to it. The platelet receptor will get hooked to the receptor, and this is how it works. So this process of addition of platelet to the von Willebrand factor is called as platelet adhesion. So now I'll show you how the platelets are getting activated. So the platelets have some granules, that is delta and alpha. Delta have serotonin, ADP and calcium, and alpha have platelet derived growth factor. So what this will do, this will help the injured area to bring back the collagen. And what these three will do, these three act as a vasoconstrictors. So as we know, serotonin is a natural vasoconstrictor in the body, but this ADP, as I've told you that the ADP favors the platelet to get attached to the collagen surface. And this calcium, I'll show you some example how calcium works. So for example, these two are the two coagulant factor, and the both are having like electronegative charges. So they cannot attach, they will always repel. So what calcium will do, calcium will like come in between of them, and as calcium is electropositively charged, it will attract these two and there will be a bond in between. This is how calcium work. So this is the function of serotonin, ADP and calcium. So and this whole process will activate platelet. And also one more thing is there, that platelet will always release thromboxane A2 and arachidonic acid, and this helps the platelet to get activated. So this process is called as platelet activation. So here this ADP will get attached to it and it will attract other platelets also. So this is how the clump of platelet will get attracted and attached, and this process is called as platelet aggregation. And in this process the platelets are all aggregated, but this is in the loose form. So this is known as primary hemostasis plug. Actually in this process the platelets are not tightly bonded, all are loosely bonded. So what will happen, there will be fibrin getting deposited on it. So as fibrin will getting deposited on it, it will be somewhat tighter, so it will be somewhat dense in nature. So this process is known as secondary hemostasis plug, and this whole formation is called as clot. And I have already told you the definition of coagulation. So this is clot, and when the clot is in a single area and it's not immovable, so in that condition we call it as a thrombus. Thrombus is like thrombus will always present in one area and it won't be movable. And in case of embolus, it will be movable in the blood and it can reach to any part of your body. So that is known as embolus. And here I am closing the topic by discussing all these like subtopics, and I have described all the process in coagulation. Thank you.